Welcome back. If you're just tuning in, you're watching the Arthritis Show, a global information source dedicated to patients with arthritis and sports injuries. Well, joining us today exclusively on our studios is Dr. Martin Dayton. Dr. Martin Dayton practices integrative medicine here from South Florida, and he's very good at it. Hi, Doc.
Hi.
Great to see you.
Great to be here.
Doc, for people out there that they don't know what integrative medicine is, and we've been going over this in the past,
Sure.
but I just want for the newer audience to get a good idea, what is integrative medicine?
Well, integrative medicine involves the combining of conventional medicine, as is practiced in most doctors' offices, with alternative medicine, such as acupuncture, homeopathy.
Fantastic. And what type of patients do they usually look for alternative medicine as opposed to the conventional medicine?
Well, some patients do not want to risk the side effects of conventional pharmaceutical medicines and surgery. Others find that the answers that they're seeking are not well answered in the conventional medical arena.
Fantastic. Do you see more males or females in your practice?
I think I see more females, but it's not that
big.
Not that big a difference.
Yeah, we feel that we see more females too, and we feel that's because ladies usually like to seek help faster. They want to get better faster. Okay, and what is the latest in integrative medicine these days?
Oh, there's so much going on.
It's a continuously evolving field.
Continuously involving in many areas. In my area, where I concentrate in the treatment of patients with cancer and the treatment of patients with autoimmunity, there's some interesting methods that are coming from Germany. One is the use of intravenous salicylates. Salicylates is a family of medicine to which aspirin belongs. Aspirin is acetylsalicylic acid. And by giving these injections intravenously, it seems that it causes cancer cells to die. It pokes holes in the cancer cell walls, and the cancer cells perish. Quite a innovative approach.
For audience out there, salicylate is just plain aspirin. It's an aspirin compound, and that is compounded in an IV form and given in a...
Yes, it's prepared so that it could be given intravenously. Can't possibly achieve the results by giving it orally, but intravenously it does work.
And aspirin has many benefits. They use it right now to thin the blood after heart attack or prevent future heart attacks or strokes. They're using it for with the pain, allergy,
and it prevents
fever,
cancer as well.
And now it prevents cancer. Now, it's been, there's been some studies in the past that supported that, okay, taking aspirin helps with Alzheimer's, helps with a variety of diseases, but never about cancer. This is a new thing.
Yeah, it reduces inflammation, and cancer is also something that's subject to inflammation as one of its causes.
Okay. And what is this going to be given at a high dose, or is it kind of like everyday dose that you treat people with cancer? Or?
Well, to prevent cancer, perhaps 81 milligrams a day. To treat cancer, the dosages are much higher, and it depends upon the person's weight. The salicylates that are used are not just aspirin, there's some relatives of aspirin. And these medicines that are used are approved to be taken orally for patients with inflammation, such as patients with arthritis. It's interesting that now they can actually kill cancer without killing the person using these treatments.
Well, this is very important because most of the chemotherapy agents, they're very toxic. They usually go to the liver or kidney and produce all kind of problems. But when you come up with a more benign medicine like aspirin and treat that, that just changes the whole game, I would say.
That it does.
It's a complete game changer, right?
Absolutely. And there's other treatments that are available. We know now that there is something called cancer stem cells, which are cells that are cancerous, but they're not as readily killed by chemotherapy and radiation. And these are the cells that are responsible for for recurrences of cancer. So now we concentrate on killing cancer stem cells. Some of the drugs that we use, for example, metformin, which is popularly used for diabetes, is helpful in subduing cancer stem cells. Also, there are anti-parasitic medicines that kill cancer stem cells. These are medicines that are used for other purposes and approved for other purposes, but we find they're useful also in treating cancer.
Well, excellent. Now, you brought a good subject up, the stem cells and cancer. You know, there is some sort of, I would say, there are thoughts that there are some physicians who are kind of like against it. They feel that using stem cells in cancer could make things worse. What do you think about that, Doc?
Well, on the contrary, stem cells have been used in the treatment of cancer, and it makes things better.
So stem cells usually do not become a cancer cell, right?
No, well, stem cells can become cancer cells, but generally not.
Generally not. Yeah. Generally, it's a good way to fight cancers as opposed to. And let's say if somebody wants to get the stem cell therapy for cancer, usually these patients are at later stages of cancer, right?
Yeah, it's been used for later stage of cancer. And stem cells have been used for many years in the treatment of cancer. Sure, that when one method of treating leukemia or lymphoma is to wipe out the bone marrow, the stem cells in bone marrow, and then replace them with normal ones.
With normal stem cells, with normal bone marrow. Mm-hmm. Now, the thing that I want the audience to understand out there is that in order to get integrative medicine or functional medicine, people wait a little bit too long. People, I've been to your office several times, and most of the patients that you get to deal with are usually stage 3 and stage 4.
Yes.
Yeah. Do you have any advice for patients who are in stage 1 or 2 or try to prevent it?
Well, there's a tendency to do conventional medicine first. Knowing that tendency, the patients need to pay attention to the environment in which their tumors exist. That's the rest of them, the rest of the person. It's very important to get rid of toxic material in the body that prevents the body from working well. We do not want to stop the person's body from doing what it needs to do to have the immune system intact, to address the cancer itself. We need to add those things that are necessary for function and repair, the proper nutrition, have to have a proper nurturing. We have many needs. And we need to make all aspects of our beings communicate well with one another. We have the immune system, which is made up of many, many components, which communicates with one another. We have the hormonal system or endocrine system, which involves the creation of chemicals in one part of the body that go to other parts of the body and impact how other parts of the body work. And all the immune system, the nervous system, the endocrine system are all intertwined and interrelated. So if we could improve communication among the various parts and aspects of our bodies, remove those substances that prevent optimal function and repair, and add those substances that foster optimal function and repair, I think we could do very well in addressing cancer. And also we can use various methods that are more conventional to directly kill cancer too. However, we have a good environment, the patient could thrive, and the therapies that are used to address cancer work better.
Fantastic. Well, again, as usual, you brought a vast knowledge to our show. I want to take a moment and thank you very much for coming, Dr. Dayton.
I thank you very much, Dr. Farshchian.
All right, we're going to take a break at this point. When we come back, Dr. Jose Sandoval will be joining us. Dr. Sandoval practices nutritional medicine.